Social care has continued to deliver, continues to deliver, and does not need fixing. It needs to be funded. So somebody's not telling us the truth. We had about 250 people on a call saying we've got to do something, let's go march on Parliament. Is it going to shut me up? Is it hell? The role of social care is not only to support the NHS, it is a role in its own right. I would say the Home Office got it wrong when they first put the visas out. They should have been much more careful and we wouldn't have had this problem. Probably closer to about 750,000 people who can't even be assessed for social care. They need to have the professional ladder, they need to be paid properly, and all of that should be funded through government. I don't think social care needs to be fixed. I think it needs to be funded. Why would you be a carer? You'd be a carer because it's one of the most rewarding jobs that you'll ever do.
Nadra Ahmed, welcome to Voices of Care. It's a real pleasure and honour to have you on the podcast.
Oh, thank you very much. Thanks for inviting me.
Well, it's a real pleasure. It's difficult to avoid you at the moment. You're on the press, speaking so passionately about social care. We could start in so many places, but I wanted to start, if I may. We've had the government's official response to the Health and Social Care Committee's report, which is back out in May, around the cost of inaction, and they've highlighted the £4 billion almost that they've dedicated to under the spending review and extra money for carers allowance and fair pay agreements. What say you? They're painting the picture that there's a lot of money coming to the sector.
It's always, the devil is always in the detail. And so when you hear all of these, you have to think that social care is much wider than older people's services and learning disability services. It does include children's services. It includes all sorts of other things. So when it comes to the front line, the money is insufficient is the polite way of saying it.
Right. It's a family show.
So, if you speak to any provider on the front line, which is what we do that on a regular basis, it's very, very rare that you'll see anything on the front line. And COVID was the first time that we actually started to see real money come into the front line. But that was a kind of emergency situation. It was a pandemic. They needed to do that, and they did. But certainly when you hear the big figures,
yes,
the impression is there's all this money coming in. But what reaches the front line, which is what matters, on top of that, we've also had the announcements of the insurance, the national insurance contributions, which is going to put more money into the coffers, which social care will be paying, and our providers are telling us the impact is really substantial. It's putting people on the brink. We've got the VAT stuff that's come out, where people are going to be losing that as an option, where they might be able to save some money. Cost of living crisis, all of those things impact us as well. Energy costs impact the sector as well. So when you actually look at it and you look at the big money, and it's over a 3-year period and all of those kinds of things, the reality is it's not even a drop in the ocean.
And that's interesting because we've had, obviously in July, we had the evidence being given for the COVID phase, looking at what happened at care homes. And you were on record as saying, I'd like to unpack that a bit, that in some ways, because obviously you're in touch with the vast majority of providers in care are SMEs, which you represent, of course, at the National Care Association. And in some ways, and I found it surprising to listen to, but it's interesting that in many ways, the sector, it might be worse off now than they were in the COVID period.
Well, I mean, I think the COVID period eroded so much, so if there was any resilience, we were already starting to see it pre-Brexit.
Yeah.
So as Brexit was emerging, we knew that there were certain things the prices were going to go up, on things like disposable gloves, all of that kind of stuff. We knew we were heading for all of those things. As a matter of fact, I remember sitting in a meeting where they were talking about parts for lifts that come from Germany and how the price of that was going to go up. So pre-Brexit, we also saw that colleagues that were European colleagues who were working here, they were going to go back. They didn't feel that they wanted to be here. Brexit kind of gave them the message. So we were already beginning to go down this erosion role. And then, of course, COVID hit. Yeah. And the first few weeks of COVID, when everything was a bit crazy, providers were having to pay huge amounts of money. They were borrowing from banks. They were doing all sorts, adding to their mortgages, all sorts of things in order to be able to buy PPE, to do all of that. Yeah. So we began to see an erosion of the sector.
Right, from that point.
From that point onwards. And then, of course, we lost 40,000 people because of the no jab, no job.
And they left the industry, presumably, in terms of the workforce.
Well, that kind of was such a big thing because it was only social care that was going to be affected. So people left the social care sector and went to work in hospitals, which didn't have to comply. So if you look at that as the period, which, COVID, you have to kind of look at it in a 2.5, 3 year period. We then get into this situation of the cost of living. We got the energy price increases. We got all of those things. Insurance for our sector has gone up. In some cases, it was tenfold from what we were being told. But we definitely have this major increase. So the provider cost has gone up substantially. National living wage was running alongside that, which is the one thing that you kind of feel, actually, that's good. We need to be doing that for the workforce. They're highly skilled people. They're working really hard. We're looking after people who have very complex healthcare needs, and the need is growing. So you kind of want to buy into that. But local authority funding was just not following. And that's been the issue, really, where you've got 0% increases. Even at the height of COVID, we were getting 0% increases, 1%, 2%, whereas the costs were 10%.
And the commissioners were not corresponding.
Were just not. No, they were saying they weren't getting the money from government. And as I've said this quite publicly on a number of occasions, so government tells us they're giving the money to the local authorities, and the local authorities. We spoke about with the 4 billion. Absolutely, and local authorities tell us, well, we haven't got the money to pay you. Well, someone in there is lying. We're piggy in the middle, so somebody's not telling us the truth, and so we have to call that out. Actually, because providers who are, and I'm talking about people not only the ones that are commissioned by local authorities, or are on very low, so £700, which is £100 a day, which is £4 an hour, whatever. If you can calculate it backwards, you couldn't get bed and breakfast in a travel lodge for that much. So that, and we're doing 24-hour care with fairly really high complex needs. I think all of those things kind of came together, and you end up with saying, well, somebody is just not being honest with us.
And you mentioned earlier, of course, in the autumn budget last year, the employers' national insurance contributions, adding that cost with the living wage. And I think you've been very instrumental and prominent in terms of the reaction you've built up. That's a picture that you've built up of frustration and pressure. And I think the tagline was "Enough is enough." And I think you were involved with very high profile Providers Unite. I mean, I think it got to the point where policy advocacy, which you're so great at, went to the streets.
It absolutely did. And it was actually, it was quite by accident. Providers Unite was formed quite by accident. There was no design on it.
So it was a letter, wasn't it, originally?
It was a letter that we wrote to the Chancellor, and I kind of wrote it in literally 20 minutes, sitting there and thinking, this is going to be devastating. I put it through to my policy officer, Victoria Beyer, and Victoria looked at it and she said, I think this is fine. Let's just do it. Right. Passed it through the board. The board were kind of saying, yeah, no, let's do this. And one of my board members spoke to somebody else who was in the sector and said, Nadra's written this letter. And the person said, oh, can we have a look? As soon as they saw it, they said, oh, we want to sign up to it. And so it escalated.
Right.
So by the time it went out the following day, there was about 125 people that wanted to sign, which included all the national bodies that part of the Care Provider Alliance, we had local associations all signing up. So it kind of captured the mood, if you like.
Absolutely. March on Parliament.
And the March on Parliament came
later.
afterwards.
Yeah, that's right.
It kind of what it did was it just escalated.
And it galvanised into a movement.
It galvanised it. And then we thought, and then people were just saying, I mean, the first meeting that I chaired of Providers Unite, we had about 250 people on a call saying, we've got to do something, let's go march on Parliament. And I kept saying, oh my God, that's a bit big.
From a 20-minute letter that you were on, you marching on Parliament.
Didn't intend to do that. But what was interesting was there was so much passion in it. There was so much people wanted to do something. And so I said, well, I'm not marching on Parliament if we've got 400 people. We need at least 1,000 people.
Right.
So people started signing up, saying they'd be there. They were hiring coaches, and it just
February 25,
really,
I think, yeah.
So we had 3,500 people in the end who actually on the day turned up. And I was still stunned on the day, sort of standing there thinking. And then on top of that, we had, I think we had 7 Lib Dem MPs come out. And the act was, I think we wanted it to be not aggressive. We wanted it to be... that we are caring people. This is really being done unto us, and it's really hard. And I think the most important thing it's done is we've got, I think it's now 240 MPs who have been into a care service or corresponded with providers. So providers have been empowered to look at it. It's the engagement. And so now they keep asking me what to go and do next.
And it's not been easy because the press have not given you an easy ride actually throughout this either. I mean, you're putting your neck. I mean, you're very brave around this. But you have people have a shot at it.
Yeah. And I think that's sadly it is just one of those things, which is why providers do get into this where individuals like myself and others, as soon as you raise your head above the parapet, there's always somebody to shoot it down, and the reasons behind it are often quite personal. They're quite vindictive. They're quite, challenging. But at the end of the day, the voice is not just mine. It's the voice of lots and lots of other people. It's just that I happen to have fallen into that place, and I've got a fantastic board, and I've got amazing people like Kat who are on my board, and Victoria, and there's the passion behind it. So is it going to shut me up? Is it hell?
I wouldn't have bet against it on that one. Let's stay with the National Care Association. I don't want to remind you how many years you've been involved in social care. I think back in the 80s, it's a very different level of provision. But tell us a little bit about the National Care Association, obviously representing SMEs. And you've got some very core missions about levelling up care and really bringing the contribution of social care to the forefront as well.
Absolutely. I mean, I think it is about valuing social care. So, National Care Association was founded. It's the most established of all of them because it was founded in 1981.
Yeah.
And RNHA preceded it, which is now, we're one organisation now. So we are the ones who have got the longest kind of history, if you like, of representation. And we've not ever really moved away from our core missions, which is to support the SME providers, speak up for them, and to
fair
work
funding,
with them.
etc.
It's the mission, it's the value, it's the value of our workforce. It's about making sure that people understand that the role of social care is not only to support the NHS, it is a role in its own right. So we've moved from social care being something that was to combat loneliness in the 80s to where we are now, which is pretty much cottage hospital style living.
More complex.
Much
needs.
more complex. At that time, our staff didn't have to have too many skills. They, knew how to bathe somebody, make a bed, feed, all that kind of stuff. Now we're looking at some very challenging conditions like dementia, challenging behaviour, stroke, all of that. So the sector has moved considerably, and National Care Association has always tried to keep pace with it. So we went from being just for care homes to home care quite quickly. Then we were asked to take on learning disability services, only because providers were diversifying as well.
Moved into those sectors.
So somebody would be a member and say, I've just opened a domiciliary care business. I want to be part of NCA with my full business. So it's happened. I think it's happened. It's evolved.
It's taken a life of its own in many ways. You talked about the complex. You mentioned almost a hospital at home type of situation with more complex clinical requirements for staff. And I just want to segue slightly because obviously the 10-year plan published in July by the government, the department, and that obviously brings into fruition some of the observations of Lord Darcy's report in September 24. And at the time, I'm reminded that Keir Starmer said that we have to fix social care because we can't make the NHS fit for the future without fixing social care. I think it's probably a direct quote from the top of my head. 10-year plan, is that giving you some hope for social care? Because Darcy said without social care, the NHS cannot operate.
Yeah, so I have quite a different view about this because I don't think social care needs to be fixed. I think it needs to be funded. That's all we would say. I don't like that terminology that we need to.
It's Starmer's, not mine.
Yeah, well, we won't say anything about that then. But it implies that social care is broken. Well, social care has evolved.
Yep.
We have looked after people. We have continued, and it's providers who've invested in it. Yep. It's the provider sector because the government's never invested in it. They only invest in us to support the NHS. And I'll come to the 10-year plan in a moment. But I think that's the piece. So they want delayed discharges. They wanted COVID people to be so money was being thrown at social care in order to so that the NHS wouldn't be overwhelmed. All of that kind of stuff.
That was the language, yes.
That was the language that was being used. And so for me, there's a really important distinction here. Social care has continues to deliver, and does not need fixing. It needs to be funded. It needs to be properly funded, and there needs to be a strategy for us. We don't have a workforce strategy, for example. So last year in July, Skills for Care put together the workforce strategy. Government has never taken that on board, but it is a strategy ready for them to take off the shelf and start to. But no, the NHS has one, but we don't. And I think it's that investment in social care that is in question here. And I think when you read these things about, the NHS won't. Can't deliver if social care isn't fixed. It needs to be isn't funded.
And the social care, I guess also from your mission, it's to talk about social care irrespective of the NHS. Social care as a sector with £68 billion of gross value add, 1.6 million workers. You've made it very clear in your own inimitable style about what the problems are. I want to just step back, if I may. There's many accolades you've received. OBE in 2006, I think, if I'm right. 23, you got a CBE. So if anyone knows about what's going on in social care, can you bring this to life? Because we talk about policies and fundings and reports. If we don't fund social care, not fix, but fund social care, what's society going to look like in 10, 20 years?
Well, I'll probably be one of the people who will be kind of overlooked. This is the challenge here is we're enabling by keeping quiet vulnerable people to be ignored. The fact that they've got 500,000 and actually that number multiplies on a daily basis. So we're probably closer to about 750,000 people who can't even be assessed for social care. They're not receiving it. You've got just under 6 million people who are unpaid carers. That's a society that we're developing now. And if you go back to the 10-year strategy with the neighbourhood health plans and all of that, it's going to put more pressure on that sort
community
of
provision.
on the community, and that's fine. The GPs will be funded to do it. The pharmacists will be funded to do it. Everybody will not come to the table until they've had the money to say, you can have more appointments, you can do this. Social care, for some reason, appears to be invisible in the minds of the Treasury, because they don't understand that we need to be funded as well. We have circa 10 billion shortfalls in our sector, but we carry on taking on additional. We're Streeting very cleverly announced that health tasks will be passed through to social care, and then in a couple of weeks later, Keir Starmer said unskilled workers. How do you pass healthcare tasks to unskilled workers? They need to kind of think of their narrative. They need to think about their language, because that kind of just doesn't make sense to me. You wouldn't do that. The only reason you would pass healthcare tasks into social care is if you believed that the workforce could deliver it. And in order for them to deliver it, they would have to be highly skilled. And if they're highly skilled, they need to have the professional ladder. They need to be paid properly, and all of that should be funded through government.
Yep.
But that piece seems to be the missing piece in their heads when they're thinking about the puzzle. And it's hugely frustrating for people like myself and others who are advocating in the sector, because we can see the reality of what it might look like, because those numbers are only going to go up unless there's an investment in social care to make it stable, robust, sustainable. We have a workforce that we can rely on. All of those things.
No, it's important, because I think that picture, to bring it to life, is important. I mean, you talked about the numbers. I think the Health Foundation, when it's projected exactly as you say, 8 billion is probably what's needed. The 4 billion it will perhaps prevent things deteriorating rather than actually providing. So it seems disjointed from what you're saying.
It might prevent it, but actually all it will do is help fund what additional stuff they're putting in there.
Right.
So actually, it's almost like a nil return. But yes, you're right. I mean, it won't touch the sides.
Well, I want to work. You mentioned the workforce several times, and it's one of the core missions, one of the things I think you're really, really passionate about. And I just wanted to touch upon that now and talk us through about some of the challenges. And also, I want to spend a minute, if I may, with your expertise to recognise, because I think that's one of the key things, recognise what the workforce in social care now is required to do and does every day.
Absolutely. I've been following a gentleman on LinkedIn who is obviously a carer, and he records his day-to-day activity in a care setting, and how much is paid for it, and it is an absolute pittance when you kind of look through it. So social care, not only are we delivering personal care, emotional care, support for interactions, for talking to each other with people with very, very diverse and difficultly complex conditions. So this is not the cream tea society that used to just come in because they were a bit lonely. These are people who have profound needs.
Yep.
And if you have 40 beds and you're going in, you never know what's going to happen next. You don't know who's going to become unwell, who might have an infection and their behaviour will change. You've got to recognise all those symptoms. You've got to make sure that the nourishment is there. You've got to make sure that the medication is there. You also need to support families, because families are becoming much more concerned about what goes on in care services for all different reasons. And we have a really good focus with our families, because they're our ambassadors. Yep. So a lot of providers will tell you that, you want them to be part of it. But sometimes it becomes very difficult, end-of-life care. It's our carers that are sitting with them and supporting them in every way that they can. And I've lived through this because my father was in that.
You cared for your father.
My father and my mother, both of them. So these are really, really challenging times. Why would you be a carer? You'd be a carer because it's one of the most rewarding jobs that you'll ever do. And you will undertake life skill training, which will last with you forever. That's the thing. That's the difference between being a delivery driver or working in a shop. Being a social care part of the social care team, you will learn skills that will be there forever, and that's what you take away with you. But also, you'll walk out of a building, now you've made a difference in somebody's life. You'll have crap days. That's true.
Sure.
But you will always have that smile from somebody who hasn't smiled, being able to get somebody to walk, getting some interaction. Those moments are probably the most precious moments that you'll ever have with people. And you do that day in, day out, day out. But it's stressful and it's hard.
Absolutely. And looking into that future crystal ball that you've talked about, all the projections, I think Skills for Care, 430,000 more staff needed in the next less than a decade now. I keep thinking it's 2025, of course. Now, that's a serious issue because as the complexity need goes up, we are going to, and the aging population, we're going to need to somehow find these additional workers. As you know, recently, in the last couple of years, post-COVID, international recruitment has been very significant. Domestic staff have left. That path is now shut effectively with the changes to the visa. How are we going to square that circle? Where are we going to get the people to provide those numbers of staff?
Now, if I knew that, I would really have a crystal ball. I think we've got to. International recruitment always had to be a short-term solution.
Yep.
But it needed to be tapered. It needed to be tapered
rather
in a
than
way,
shut down.
rather than shut down. So it needed to be tapered in a way that we could have said we'll have 10,000 less or whatever the figure might be.
Right.
But at the same time, you need to be building up your domestic workforce, and the only way we're going to do that is to have a qualification agenda that's right and proper, and then a payment methodology that was right. We also need to change the narrative. We need politicians to stop talking about low skill. Mm-hmm. We need them to start respecting social care because their narrative makes it as a subsidiary to the NHS or or derogatory. There's all this stuff that comes out, which drips into the public consciousness. And so what then happens is the public believe that everybody who works in social care is just minting it. Well, there might be a percentage of people who are running very successful kind of private-only services, and good luck to them. Yep. People are willing to pay it, they go into those services. But 85% of the sector is not in that field.
Which you represent, of course.
And they're the people that we represent. Yeah. And even our private payers, when they're paying privately, it still doesn't make up the shortfalls that we need quite often. So I think, unless you buy into the robots looking after people, and telecare has an absolute place in this because we know that it will help. Yep. But somebody with dementia hearing Alexa might not be the right thing. So we've got to be thinking
absolutely and
on our feet.
Yeah, and you've been quite radical, I think, perhaps to think about who could we tap in terms of workforce and people to actually help train.
Absolutely. I mean, I think there are people that we have to think about. So we've got the displaced workers, which they brought that in. And just to put it on record, again, I would say the Home Office got it wrong when they first put the visas out. They should have been much more careful, and we wouldn't have had this problem with people setting up these agencies and actually, fleecing these poor people to come into the UK. So they're legally here.
Yes.
But they're displaced workers.
Right.
So absolutely, we should be trying to recruit from them. Yep. The problem we have is that those displaced workers have come in on false documents. Sometimes they don't have the qualifications. We'd be putting our own people at risk in a care setting if we took them in, unless we could skill them up. Yep. And so that's the one piece that's really important. But also it is to do with our sector and the way that we're perceived when it comes to it being a profession. Yes. And we do need to move this forward. We need to be talking about social care workforce as being highly, highly skilled, because sitting with somebody who's at the end of life care is not for the faint-hearted. It is for the highly skilled. How you support that person, how you actually can deal with your own emotions at the same time. All of those things matter.
And just touching upon that skill point that you've made, of course, you've know skills for care very well from all the experience you have. There's going to have to be, I guess, a step change and a lot of work and maybe innovation in how training is actually delivered. I know that's a background that you know really well. So just want to touch your views on how training will need to change in terms of supporting people to get the skills they need.
Well, I think, we've got to be clear what the skills are that we need.
Yep.
For me, we do have to invest in that training program. We need to be very clear that we know what it is that's required, but we also have to tap into the golden thread of individuals. We must never assume that somebody who's on the unemployment line will be eligible and right for social care, because unless and until you know what it means to care for vulnerable people, or it's a learning skill, you can't do the job. It is not an easy job. And for me, that golden thread is compassion.
Amazing. One final thing. This is a bit of crystal ball, and because I know it's very passionate. One of the missions for the National Care Association, Pritesh Mistry, the King's Fund, has written really extensively around the potential for digital and data technology in social care is great, but you've got to get the basics right. What have you seen, and what do you see in terms of the potential digital opportunities, tech opportunities that are there within social care, subject to the funding?
Well, I think it's really interesting, because I get blown away with, digital kind of records and all of that, which when, my day, you wrote it in a notebook and said, Mrs. Smith has eaten really well or whatever. But now you can actually do all sorts of things with it. And I think it is right that we've got to move down that way, because it frees up. The purpose has got to be that it frees up an individual's time to talk to somebody on a one-to-one. So I think that's really important. I'm not sure about robots, but I am told that in Japan it's quite normal that you kind of have these sorts of things, and it will happen. Digital technology, I think, has got to be there. It will enable families to be able to look at what they're to be communicating if they're in Australia, all of those things, be able to do. I think we've got to take our workforce with us as well. I think that's the other thing, because quite a lot of the workforce don't want to do that. But GDPR is really key in this. We've got to know that it's safe and it's secure. So my biggest challenge with this is that if we had a power outage, what would happen? So we've got to
get the basics, infrastructure.
Get the basics right. Get the care right. Make sure individuals coming in have the right induction training, the right specialisms that they want to be looking at, be leads in occupational therapy, or, be the lead in whatever, having cinema nights or whatever it might be. Just harness all the potential you can. Reward the staff by believing in them, and that will enhance the culture within your service. But technology has only got to be there to empower people to do their job properly. It can't take over.
Absolutely. Nadra Ahmed, thank you very much for your time today and for your wisdom.
Thank you. Thank you very much for inviting me.
If you've enjoyed this episode of Voices of Care, please like, follow or subscribe wherever you receive your podcasts. And if you want to learn more about how we're turning the dial on the health and social care debate, please visit newcrosshealthcare.com/voices of care. In the meantime, I'm Suhail Mirza. Thank you very much for joining us today, and I look forward to seeing you on the next podcast.
Voices of Care, the Healthcare Podcast.